I'm Dr. Larry Santora. Thank you for watching Heart, Health, and Home. Today I'm going to discuss the test that we use to diagnose COVID-19. There's two types of tests. One is an antibody test that shows whether you've had the disease in the past, and the other one is the acute phase test that tells us if you've had the disease acutely right now or within the past 4 or 5 days. Let me talk about the antibody test. This is not as widely used, but it's a very simple test to use. We use a cassette, something like this, and we take a little finger stick, a little prick of blood, and we put in this pipette, and we feed it into this, drop it into this little cassette here. Then we put some drops of reagent in here, and then it seeps down into this, and this will turn certain colors if the antibodies are present. If you have this, that means that you've had the disease sometime in the past, maybe 10 to 30 days ago. And when you have the infection, antibodies come out to fight the infection. They appear in the blood around 10 to 14 days and may last up to a couple of months. So this is a very nice test to use if you want to know if you had an infection in the past and did you have COVID. The other nice thing about it is that these antibodies may be protective. We don't really know if you have antibodies to COVID, if it really gives you immunity, but we will find out in the near future. But this test can also make you a donor for a convalescent serum plasma, which can be used to transfer these antibodies to other people who have the disease and help them cure or be treated more effectively. The second test are to see if you have the disease now. So if you go to the emergency room or your physician's office, you have a cough, a fever, loss of taste, you're short of breath, and you want to know if it's COVID, there's two tests that can be done. One is an antigen test. This can be used on a nasal swab or saliva. And then there's the more common PCR test, which is a molecular test that picks up antigens, but viral particles in the nasal swab. So that requires a nasal swab that goes all the way back and picks up the viral particles. It's on a swab that's put in a tube, and then reagents are added. Some facilities have the ability to give you results right away. If you have the results right away and it's positive, you very well have the disease and you can initiate treatment early on. So if you have it, it's very accurate. So there are a few people who have false negatives, meaning that you have COVID, but it turns up that you don't on the test, but you really do. So the false negatives are a problem, but you have to put the whole picture together. The other test is an antigen test. It picks up abnormalities on the viral cell, and you can pick that up in the sputum or with a nasal swab. And that's a little cheaper, and it can be even faster. The nice thing about that is there's a potential that you could have multiple people put their saliva in one tube, like say you're testing kids at school, and that they can all be tested, that one bunch of saliva with one reagent, and then if it's negative, nobody there has the disease. If it's positive, then you have to go back and test each of these people to see which one of them contributed the saliva that was infected. The new thing that's coming out, there is going to be a combined test where you can, if you go to the emergency room and you don't know if it's influenza or if it's COVID, one test will determine whether you have influenza, which can be treated with like Tamiflu, or if you have the COVID, which requires a different type of treatment. In addition, the quarantine with COVID is different than the quarantine with influenza. So that's another thing that's coming in the horizon. So I think there's a lot of confusion about these tests, but you should use the acute COVID test, the ones that I mentioned, the molecular and the antigen test, either from the nasal swab or sputum, to see if you have symptoms that are due to COVID, like fever, cough, shortness of breath, or if you've been exposed to somebody who's had it and you want to know if you can get back to work, you can get this test, but you most likely may need to have it done again because sometimes in the first 5 days it's negative. So you may need to have it done. If it's negative, then repeat it a week later. One thing I want to say about this is that how we report patients having new cases, if you have the COVID test and it's positive, you're going to have to go back and get it tested again, and it may come back positive again, and this one person will be counted as 2 new cases. Even if you have an antibody test that's positive, that will be counted as a new case. So some of the numbers that we're getting may not truly reflect new cases, but they're reflecting new testing on the same person who already had a positive test. So they skew the numbers. Anyway, we're gonna make great strides in the next 6 months, and I'll keep you updated on those. But I think we could approach this in a very scientific manner. You have to put it together with your clinical symptoms, and I think it's going to go a long way in not curing this disease, but making it very, very manageable for all of us. So thank you for watching. I'm Dr. Larry Santora, and my next guest or co-host is Nikki Johnson. She will talk about the latest in the insurance market, mainly Medicare, and then Mary Sanchez, who will talk about some tips about the real estate market. And these are all very important topics in this COVID era. Thank you for watching, and we'll see you next week.
Hi, I'm Nikki Johnson, a health insurance agent specializing in Medicare. Medicare can be confusing, so I'm here to assist people with questions about Medicare and how to navigate the system when they first turn 65, are retiring and coming off an employer plan and applying for Medicare for the first time, and even for those people who have been on Medicare for many years but want to compare their current benefits and update their current plan. Today, I want to discuss Medicare supplement plans, also known as Medigap plans. Medicare supplement plans are insurance plans sold by private companies. They help you fill gaps and pay for coverage that original Medicare does not. When you choose this kind of plan, you have the freedom to go to any provider in the US who accepts Medicare. You have direct access to specialists, meaning no authorizations and no referrals are needed on this plan. It's important to note these plans come with additional premiums. Monthly premiums are based on your age and your zip codes, and the rates do increase over time. Also, enrollment is based on medical underwriting. However, certain guaranteed issue options can apply and are available. These plans typically have very limited value-added services, so things like dental and vision plans must be purchased separately. Also, most importantly, Medicare supplement plans do not cover drugs, so a separate prescription drug Part D policy must be purchased. The open enrollment period for people on Medicare supplement plans is once a year during your birthday month. So during your birthday month, you can shop around for other types of Medicare supplement plans if you wish. Some restrictions do apply to this birthday open enrollment, and some people may be eligible for other types of special election periods where you can choose other types of healthcare coverage. If you have any questions regarding this, please feel free to give me a call, email, or text on the number listed below on the screen. Until next time.
Hi, my name is Mary Sanchez, and I specialize in residential real estate here in Orange County. Today, I'd like to talk about leveraging the equity in your home. According to Burns Consulting, 58% of homes in the U.S. have at least 60% equity, and 42% of all homes in this country are mortgage-free, meaning they are owned free and clear. In addition, an average equity in a home mortgage is $177,000. That's a tremendous amount of forced savings for homeowners in today's market. As a homeowner, you may have more equity in your home than you realize, using it to make your move to a new home while interest rates are hovering near historic record low may be the best decision you could ever make. In this season that we're in, when inventory is limited, equity is high, and interest rates are low, homeowners who are in a position to sell are in a great place to win. Whether you are thinking of purchasing a larger home for your expanding family or downsizing because you are contemplating retirement, in this current market, working with a trusted real estate professional who can help you follow all the virtual guidelines and protocols recommended by the National Association of Realtors to make sure that you, your family, and your buyers are safe, healthy, and protected along the way. I'm available to connect with you to see if your home equity positions you to make your next move sooner than you may have thought possible. Please contact me and I'll be happy to help you in any way I can.
Well, I want to thank you for watching the show today. I have a deal for you. I'm going to send a item that may save your life. Actually, 2 items that may save your life. So the first 50 people who write into our email address, hearthealthhome@yahoo.com. The first item is a book that I wrote called The OC Cure for Heart Disease. This, I think, has potential to save your life because it talks about the coronary calcium screening test on the electron beam CT scan. This is the single most important test, I believe, in medicine today. I wrote this book with NFL superstar Dick Butkus. It tells his story and it tells you all about heart disease and how to utilize this very important test. I think you'll enjoy it and it'll be yours for free. The second thing I'm going to give you that may save your life is this fantastic mask. I use this cloth mask instead of the paper ones, and it's very, very comfortable. You can talk with it. It doesn't smother you. It's not hot. It's washable. And frankly, it looks much better. And it also comes in different colors. Obviously, we can't give you the color that you want, but we will send you the book and a mask for the first 50 people who write in. So thank you very much for watching the show. We appreciate any comments that you may give us. Hopefully they're good comments, and we will see you next week. Thank you for watching. I'm Larry Santora, and this is Heart Health Home. Thank you.